As always, a flood of questions are coming in, so I'll be reading these anonymously so as not to embarrass you in the order they come in. And if there's time after, we will open for oral questions. Number one, are there any assessment tools such as the DISC, DISC, or Myers-Briggs assessment tool to assess personality disorders?
Um,
Are there any assessment tools such as the
yes, yes,
DISC, or is it DISC, I
yes,
guess, or
yes,
Myers-Briggs assessment tool to assess personality disorders? Does that,
yes,
you okay with
yes.
that, Micah? Okay.
There are assessment tools for personality disorders. Probably some of the best instruments exploring personality disorders were developed, and you may want to look him up, by one of my great wonderful professors, Dr. Theodore Milan. Professor Milan was long ago, before my time, was at Lehigh University. He was um, um, University of Florida and Harvard also. Dr. Milan would be a person. He developed a number of the different instruments, long list of them, but he did develop several instruments, and some of them you can scan them. You have to buy the program, and they will give you indication of different personality disorders. I would say he was, without a doubt, one of the great, um, probably the most knowledgeable human being that I know of, and study of personality has been a major part of my work, especially in psychosomatic illnesses. But he would probably knew more about personality disorders than anyone else. So uh, please look up the Theodore Milan's inventory. And he had Dr. Milan developed also a number of inventories that had to do with health. So they would give you certain uh, health indicators, who's likely to develop more illnesses under stress, etc. Um, the Milan inventories. I have actually one of his books somewhere in my office where he actually signed it for me, but I can't at this moment locate it. So I hope nobody borrowed it, because I would be really sad. So, um, from my perspective, I use psychological tests, and clinical psychologist. You do psychological tests. Uh, to me, one of the best ways of assessing personality and personality disorders is through, which is what psychiatrists do. Good psychiatrists do, is through a clinical interview. And although I may be gathering data about their sleep and sleep habits, etc., I'm also collecting data on personality tendencies. Uh, so I use clinical interview. Um, Personally, if I want to delve deep into certain personality dynamics, which I think may be causing problems, I use projective techniques. Oftentimes, that is not possible, or we don't have time for that. But if I needed to go deeper into their dynamics, I would do that. So I would stay close, if I may, at least initially, I would stay close to inventories developed by Milan, uh, Theodore Milan, and he had a number of them, slew of them that he developed, and he does have one that actually picks up personality disorder. I'd say it's a little um, personality disorder happy, kind of too sensitive. He picks those up a little too quickly, but then you corroborate it by adding clinical data. So I would never go by what the test tells me. This is not like a blood test. Psychological tests provide one facet, one dimension of what's going on inside a person. So I would combine that with the clinical interview. Uh, but thank you for that question. That's a magnificent question, and yes, there are instruments, and personally, I would go toward things that Theodore Malone developed. He passed away just a couple of years ago. Just a tremendous, tremendous human being. So knowledgeable.
Okay, question number 2. I have a 44-year-old male who came in recently as a new patient. He had a difficult childhood, and I feel like he has spent his life running from his childhood memories. He constantly refers to himself as a, quote, alpha male. He's had several jobs over the past 30 years. He lives in chronic pain due to breaking both of his hands from years of martial arts. He has 2 bad knees from years of track and field, chronic back pain due to weightlifting, excessive weights over 1,000 pounds. He seems to, quote, know everything. He seems to know everything. He came to me for an oral appliance therapy because he can't tolerate his CPAP, and he has an AHI of 92. The question, doctor, is what is this man's personality?
There seems to be a lot of physical damage and physical injuries. So some something in the background, if you don't mind. So I want just a little more information regarding this. So when you see the damaging the body, it's could be actually a way of trying to disconnect from something in the past. Sometimes the body becomes a punching bag for releasing frustration. So there could be some displacement at work, um, externalized, thrown at the body. So why is he so? Why is he so engaged in injurious behavior? Some pain is if you don't mind writing this down, pain is a powerful distractor. So if I'm in pain, I don't have to look at certain things. I am an alpha male is saying to me basically, don't get close to me. I want to be in control. I want to be in charge. So I will respect that. I absolutely respect that.
Okay.
So avoiding, so pain becomes a source of distraction. So when you reduce the pain, when the pain calms down, is why are you punishing yourself? So that would be one of my questions. What have you done wrong that you deserve this kind? Why not waiting 10 pounds, 15 pounds, and you have to? What are you trying to prove? But also, it's self-injurious behaviors, which can have all sorts of shapes and forms. It can tell a lot about what's happening on the inside. Who are you punishing? Why are you punishing yourself? Why are you demanding such things of yourself? So these broken hands and knee problems, etc. It's a form of externalizing these conflicts. So it must go beyond this body, and you have to see what is it doing to relationships, people around them. He definitely says to you, I'm an alpha male, don't get close to me. If the person who wrote that question, if you are, or you're male, if you're a gentleman, he's basically saying, I'm going to compete with you at some level. And he knows his stuff, and don't put him in a position where he needs to exert his alpha male tendencies. But I'm not here to compete with you. That would be one of the messages I'll give him as quickly as possible. Reminds me actually of a gentleman that who had to constantly remind me what a wrestler he used to be, to kind of get my attention. It's like, sure, you're great. I'm not good at doing those things. So to make him feel comfortable. But he's giving you messages. There's some sort of self-punishment, self-punitive tendency that is at work. So self-mutilating, self-damaging. I've seen some comorbidity, more than one personality disorder, but a couple of them at least. I need a little more data, and if you don't mind, this is just friends talking to each other. If you'd like to send me an email and provide me with more data, as long as you know it's a friend, as colleagues speaking to each other, I'm not asking you to do a professional consult. I can maybe fine tune some of those observations and ask you to ask some question that can shed more light into this situation.
So, Micah, while I heard you answer this question, I also heard you ask for more data. And as I listened to you and I read the first part of this question, running from childhood memories, and then there's a whole slate of years of chronic pain, my question would be, is this also a way for this person to seek attention from caregivers who would provide a more positive circumstance to his life, assuming that what he was running from was negative and perhaps physically hurtful, and that was a way to reconnect with a loving environment? Does that sound a bit far-fetched or no?
No. That's wonderful, and it goes with the previous lecture last times. When you see injury, especially to the hands, it suggests a level of helplessness. But
Okay.
there's something that he's not just developing certain symptoms, he's doing things to injure himself. So that first sentence that you read, that was, to me, that was huge red flag.
Okay.
Running away from things that I should be punished about. That's something that came to mind. So I need more clarification about.
Yeah, well, I'm sure our members will entertain your private conversation offers after tonight. There's a follow-up to the same question.
Yeah.
This is about the man that we've been talking about for some time. If the oral appliance helps him manage his pain better, will it set him back? If the appliance helps him manage his pain, will it set him back?
That's a beautiful question. So please, if it helps him manage his pain, you do not want to discharge him. You want to keep a door open. So this will work, but I'd like to see you in a few weeks, and then we can work on other areas. Maybe we can add, update something. It said, come back, let me take a look at you. You do not want to give them a sense that the oral appliance has taken away the pain. I don't need to see you anymore. Then the anxiety shoots up. But I do want to see you back and see what else we can do, make adjustments. So however you schedule those follow-ups, is pain is coming down, don't space them like I'll see you in 6 months. Say, come back in 2 weeks or 3 weeks. Let's take a look at it. And then give him the opportunity to come back. It's like something comes up, call me or we'll set something up, etc. So don't close any doors. That's when the anxiety will shoot up.
Okay, one more question, but I've just been told by my producer that I forgot to launch the poll. So give me a second while I do that. The poll is now launched. So you can, as you listen to the questions, please answer, will you support ongoing webinars? And would you be willing to pay a small fee for that? And I see our speaker left for a drink of wine.
I went to find Dr. Milan's book, so I'm really disturbed that I can't locate it right now.
Well,
that's okay.
While you think about it, and while our members are answering the question,
please,
can you entertain another question?
Absolutely.
This falls around the regulatory framework that we all practice under. So in Ontario, the love of our lives is called the Royal College of Dental Surgeons of Ontario, referred to as the RCDSO. They expect us to manage our patients' expectations. Do the different personality types require different approaches to accomplish this?
Yes.
If so, do you think you could do a seminar on how we should modify our approach depending on some of the characteristics we see?
Yes, that's beautiful. These lectures actually will help you manage those expectations. So these 3 personality disorders that we talked about, avoidant, dependent, and obsessive compulsive, it is extremely important to spell out those expectations and to break them down into phases of treatment. It is the best thing you can do for them. We're going to give you an appliance and you're going to sleep better. No, we're going to do assessment. We're going to try this out. And so you want to give them structure, very predictable. So one message you want to remember. So if you make, if you create structure, number one, and then
No, he's
make things,
babbling away. He's
make things
questions.
predictable.
Okay.
So the key is to make things predictable. Then anxiety goes down, and you will see patients who will be working with you much more effectively. They will be more compliant or adhere to your, if you reduce the and setbacks, how you deal with setbacks is extremely important. That if there's a setback, it's nobody's fault. You want to explain to them. It's like you're learning how to ride a bike. Just imagine a good parent holding a child as he or she's riding a. You're gonna fall, and you know we take care of that in the end. We get on the bike again, but I'm holding you while you're going through this. You're building a therapeutic relationship, which is like no other discipline. You're regressing them without knowing it, which means you can help them at a much deeper level in many ways. And you need to protect yourself because I fell and I injured my knee. It's your fault, Daddy, because you should have held my hand. Except that you know you're not Daddy, and this is not a 5-year-old. It's a 40-year-old, and you're his or her doctor. So being aware of those dynamics is extremely important. Make things predictable, create structure. Warn them, not warn them, make them aware that setback means adjustment, that we work through adjustment. That if things don't work out, I'm not going to easily give you up. Don't say this the first few seconds, but if it's something I can't figure out, you know, there are these wonderful other doctors that we can consult with, etc. And I would warn them against, I don't know if they will get this, but it's a profound message. Paracelsus, the great physician, he said, he who self-medicates has a fool for a physician. So when people start Googling something and fixing their own problems, they're too close. They don't see things. They don't. It's not a good idea to self-medicate or self-fix these things. You know, we want to exercise and build muscles and stuff like that. But when it comes to something physiologically based, anatomically based, you need somebody to look at it from a different perspective. So, gladly, but you can apply what you're learning from these lectures.
Excellent. Thank you, Micah.